tomorrow is World Tuberculosis Day. TB remains a significant public health challenge globally and has resulted in an estimated 1.3 million deaths since 2002. While South Africa remains a global hotspot for TB, the Department of Health is focusing its efforts to raise awareness on one of the world's deadliest infectious diseases. Now let's discuss this. We're now joined by Leslie Marbury, Regional Mission Director at United States Agency for International Development, USAID. Thank you so much, Leslie, for your time. Now, it would seem, as we mark this day tomorrow, that there are still worrying concerns about the increases in drug-resistant TB.
Good morning. Hi, and thank you so much. Well, I think we have to first celebrate the progress that's been made. And for me, the theme of this year's World Tuberculosis Day, Yes, We Can End TB, is what we should be focusing on, because it's really a call to action for people from national governments, from communities, and from provincial governments and the private sector to come together. I think it's a message of hope. I think it's a recognition of the progress that has been made so far, particularly as we've recovered from COVID. And I think it's most excitingly an acknowledgement that people who are affected by TB, the community, civil society, are really taking a leadership role in this battle to tackle the tuberculosis.
Progress notwithstanding, and of course, noting, the hurdles that you had to jump, of course, to achieve some of these successes. We still are looking at over 33%, of TB deaths, which occur in the African region alone. Why is that? Why do we still have people dying from TB? I'm particularly, just looking at the slogan for tomorrow's theme, which is, yes, we can end TB. So where are we struggling?
I think that's a great question. The challenges remain. And one thing to note about TB is it disproportionately impacts the poor. And so people that have other risks, including diabetes or HIV or other health risks, are even more vulnerable to TB. So one thing we have to challenge is overall improving the health in those communities. One of the things that we're really excited about that the Deputy President will be announcing at World TB Day is a new partnership with the U.S. government and the South African government that builds on the 20 years of partnership. And it's planning to tackle exactly what you're outlining, is what are those remaining hurdles. So happy to talk a bit more about that, but look at how we're getting more targeted and more localized in our response.
Perhaps as you answer that question, just go back to my first question, which is the concern of the increases in drug-resistant TB. Just talk a little bit to us about how that, significantly will impact on the increases that we are currently seeing today, and of course the number of deaths.
Absolutely. So I think there's a couple of points here. One, we have to get people to diagnosis early, and that includes to be able to diagnose drug-resistant TB. Getting diagnosed early and often, and the call to action here is for people who are coughing or uncomfortable to go get that diagnosis. And the second part is getting people on treatment. And this has been a challenge. Imagine, as I mentioned, sometimes the people that are affected are thinking about feeding their families. They also have to get to health centers where they can get that treatment. One of the exciting things that we're working on and will be doing more is making the treatment easier and making it shorter treatment regimes, excuse me, so that people can get better faster. And then the third thing we have to really focus on is transmission, and making sure that we have the tools in communities that are healthier, that are contact tracing, and some of the basic community health lessons that we learned from COVID are carried on.
And Those are important points, Leslie. I just want to, follow up on that. You speak about, getting people on, treatment and also being diagnosed earlier, which would perhaps help. But how do we make sure that those, who are diagnosed and also those that are receiving treatment stay on the treatment? But because we've seen that some people find that the 6 months treatment is too long, but then it necessitates, some of these numbers that we are seeing to drop if they continue the course.
This is a challenge, and this is a challenge not unique to TB. We see it with other health issues when people start to feel better and they stop going for treatment. We're looking at that in a couple of ways. One is to a lot of investment has been done in research and innovation to shorten the time and make it easier, make the treatment regime easier, and make it more accessible. That can look like making it easier for people to pick up their treatments and to bring medical attention closer to them through mobile clinics and other means like that. So I think that's a big part of getting people on treatment. And the second point I would just make is, and I think this is an important part of World TB Day, is just raising the awareness of the challenge. So when communities are aware, when people are aware of the threats of tuberculosis, not only to the people that are that actually have TB, but to the effect that has on their families. If they are the person that is the breadwinner of the family, that can impact the ability to help families and communities. And I think as more people are aware and we take the stigma away from TB, we will have an easier time getting people to go and stay on treatment.